In this video, you'll learn how to set up the abdominal patient. The first step is to attach the legs. You'll do this by sliding the metal rods into the slot of your choice based on the height you want the model to sit at. So you'll lift up the model and slide the leg on, just like that. Now do this for the next 3 legs. Since there are 2 ileocolic vessels in our bowel tissue, we need to distinguish between the superior and the inferior vessels through these labels on the blood lines. Now, when you're attaching the blood lines from the model to the blood lines coming from the pulsatile pump, ensure that the superior line from the model gets plugged into the superior line coming from the pulsatile pump. You'll need to attach the blood lines now. Make sure you remove the caps from each line before attaching them together. Next, you'll take the air tube coming from the model and attach it to the air tube from the TSS. And finally, you will take the grounding cable from the model and plug it into the neutral port on your cautery machine. The next step is to place the tissue into the model. So open your vacuum sealed package and place the tissue like so, ensuring the tail is inside the barrette clip and that gets pushed closed. So next you need to check for air pockets in the blood lines, and if there are any air pockets, you need to bleed the lines. And to do this, you need to turn on the blood bag, open the roller clamp on whichever line has blood in it. Next, you'll need to get a paper towel to catch any excess blood that comes out of the line. You'll remove the cap and simply wait until you see no more air pockets in the line. And once you see no more air, you'll attach the blood line to the vessel on the tissue using the luer lock connections. If you drip any blood, that's okay. Just use your paper towel to wipe up any excess. You'll need to do this for both blood lines. And again, after there's no more air left in the line, you attach it to the luer lock on the vessel in the tissue. Dab up any extra blood. And the next step will be to connect the cautery alligator clip to the butterfly clip in the model. Now that the cautery is grounded using this clip, we will attach our synthetic bowel to the tissue using this attachment. Push the synthetic part into this plastic cap and then pull down the sleeve to hide the attachment. Now do this on both sides of the tissue. And one of the last steps here is to apply the lubrication to the tissue and rub it in apply it on the front and the back side of the tissue. This will ensure the tissue doesn't dry out during the surgical procedure. Now we need to take this synthetic mesentery and cover the barrette, the cautery clip, and the blood lines and hide them from view. Take the synthetic bowel and place it over the mesentery, and take some lubricant, squeeze it on the synthetic bowel, and rub that in for that as well. Next, we'll take the ribs and the pubic bone and place these on the model. For the ribs, ensure that you put it into the groove in the silicone. And the pubic bone is attached at the bottom here with a button clip. And finally, we'll put on the belly skin. Make sure that you pull it down far enough so that this top layer of skin is flush with the bottom. And there you go. The abdominal patient is all set up.